Good morning. I would like to thank you for the opportunity to invite you to present our preclinical swine model results for the user's high-intensity focus MR-guided ultrasound for brain histotripsy. This is my disclosure. So, during the last decade, there's been a tremendous trend in medicine, especially in surgery, to go forward a comprehensive drive to less invasive yet effective procedures towards non-invasive procedures. A diversity of diseases which should be addressed using non-invasive approaches. Most of them will be done under advanced image-guided treatment. Among those procedures, currently, we are basically using percutaneous image-guided thermal ablations for brain, as radiofrequency, laser ablation, and cryoablation. But as we all know, these approaches are limited to the invasiveness of a procedure and the heat sink, what we call heat sink effect, which is caused by blood flow. Also, we should remember there's a lack of predictability when using these procedures, especially when we want to establish a good margin. We can never really know what would be the lesion size, the shape of the lesion, and also when we try to treat brain tissues, especially in proximity to sensitive structures, for example, like the optic chiasm, we cannot really predict the thermal spread toward these sensitive structures. High-intensity focused ultrasound HIFU is a non-invasive thermal ablation technique that is used externally applied ultrasonic energy to cause thermal necrosis. This method has been used clinically to treat uterine fibroids, neurological disorders like Parkinson's, essential tremor, and dystonia. HIFU brain clinical use is challenging due to the different variables such as skull density ratio, the echo-geocentric central changes, and proximity to treated areas to sensitive areas in the brain. HIFU technology involves real-time acoustic imaging, thermometry, combined with high-intensity focused ultrasound directed to deep structures inside the brain. Histotripsy is a process by which we liquefied different tissues with the use of high-intensity ultrasonic pressure waves, usually with 30 megapascal peak negative pressure. Previous preclinical studies have shown that high-intensity focused MR-guided ultrasound can target and lesion various cerebral locations with the use of craniectomy to permit the penetration of the acoustic waves. In our study, we did not use craniectomy, and we would like to present our extensive study of MR-guided high-intensity focused on histotripsy in swine models with intact skull. The Swine model study was done at the Sheba Medical Center. We used the InsiTech 4000 MR-guided system, a modified system, which enabled us to use it as a preclinical study. MR images were acquired with pickup holes, which were placed on both sides of the animal skulls. Targets were scattered within the swine's brain, within the geocentric zone. All images were acquired at pre-treatment, immediately post-treatment, and a few days following treatment in order to evaluate syndication's outcome and the damage to the brain. All swine brain were harvested, and histopathological examination was done to evaluate tissue damage in the lesion and the surrounding tissue also. This is one example of one of the animals that was studied. As you can see the brain, you can see the skull, which is intact. You can see the skull in proximity to the brain. You can see the water and the traducer, which lies beneath the swine brains. This is one example of the swine brain. This is the area that we wanted to treat. It's a 3D reconstruction. And this is an intraoperative MR imaging that we achieved. A, B are the intraoperative MR images, and C is the histopathological report. It's as you can see it as a well-demarcated area of necrosis, of liquefaction, with no edema or damage to the surrounding brain. And this is a macroscopic brain. As you can see, different locations of the brain, different liquefaction of the brain with no damage to the surrounding area, to the surrounding brain, sorry. So for the results, we were able to show that the transcranial transskull focus ultrasound did induce histotripsy in all treated animals. Post-procedural MR studies demonstrated a tight conformal lesion confined within the target volume with no evidence of extensive damage or edema or hemorrhage in the surrounding brain. As you saw before, histopathologic studies showed tissue immunization confined to the ablation zone with sharp demarcation to the unaffected tissue. All these findings correlated well with the MR findings just as I showed you in the previous image. So for conclusion, this is the first study to report a successful transcranial skull histotripsy through intact skull in vivo model animal. But additional studies to investigate the use of MR-guided focused ultrasound in histotripsy is still needed. I would like to thank our team, both in Sheba and in InsightTech. And again, thank you very much for letting us have the opportunity to present our study.